So my name's Nicola Dunn and I'm a systemic psychotherapist, which means that actually I look at an individual in their context and in relation to who they're in relationship with, and I work here at Triyoga in Camden. I think mental health is absolutely essential. It doesn't matter, what resources you have in your life or how talented you might be at a particular aspect of your work or life, but if you don't have this basic bedrock of mental and emotional well-being, it's just so difficult to enjoy all these other aspects of your life, including the people that you love. I think traditionally there was a strong stigma, and that came out of fear and misunderstanding, not knowing what people had and how long it would take them to heal. But these days I really see the stigma breaking down. I see young people being very enthusiastic and open about coming to therapy. I see far more men coming. They understand that they don't mend their own cars, they don't lift the bonnet and tinker inside, so they want a professional. They want to go to someone who understands these issues and deals with them every day. Traditionally, those sorts of therapies for people who had psychiatric issues, but actually we're talking about day-to-day stress and distress. So my kind of therapy can help with all of your relationship issues that might be with your family, your friends, your children, your parents, your siblings, your work colleagues. It can deal with if you've lost a sense of meaning in your life, that you have things but you don't have connection. You're looking for a way to actually fix your anchor again and feel refreshed and excited about your life. So I practice a solution-focused therapy, and within that it's called Constellations therapy. What that is, it's not about astrology, but it is about the fact that elements are in connection, and we are social beings. We're in connection with people. Our problems and our issues are in a context. They stop us enjoying our lives in connection with others. And this is it's a positive, change-orientated, transformative process. So someone comes to me with an issue and I'm looking to actually get them moving in their life pretty quickly. And I do that by the fact that it's a bit like driving. They have a problem, they can see most of it, but they can't see into their blind spot. And I have certain methods and techniques that we can work together whereby in combination we get a 360-degree view around that problem. And often that's very surprising for someone, and it illuminates something which they've never seen before. The client joins me, we connect. I ask them what the issue is, because normally people have one aspect of their life that they'd really like to flow better. They may be very successful at lots of other things, but there's something that's really causing them pain. So then I get them to tell me a little bit about that. I will take a little bit of information about their current situation, but also their extended family. And pretty promptly, I may have an idea as to where the issue may be. We may set up some of the figures to indicate what is around their problem, who's involved. And really what I'm doing is I am subtly working with them to disentangle them from things that are actually impacting their current life. And it's a kind of gentle, melting kind of therapy, so that mostly I can see in the client's body when there's a movement, because suddenly they'll feel something, they'll feel a release. And often they're very surprised. But then I know that actually we've actually unhooked them from something that is to do with the past and it's nothing to do with their current life. The benefits of this particular therapy is that for a start, it's solution focused. Secondly, it's actually quite quick. We take quite a deep dive, and it enables people to actually move on quite quickly. So this is not a long languishing therapy where you're going to spend years with me. My aim is to get you up and moving as quickly as possible. And it's my skill to actually see where that hook is that you're caught in, which you can't see, which is actually stopping your life moving forward. This type of therapy is suitable for people who have actually identified probably what the area of life is that they want to work better. They don't need to know the cause of the problem. That's for me to actually work out. They just need to know that there is an area that they want to work better. They need to maybe have the capacity to think that possibly it could be different, that their life could flow in a better way, that they could be happier. We need a little glimmer of hope. All I need is a crack of light, and then we can actually work to widen that. So people can find me pretty early on a Monday morning and try yoga. So if you fancy an 8 o'clock session, I'm here from 8 until 12. We all look after our bodies because basically they squeal loudest. If you've got a tight neck, you see a massage therapist. If you've strained your leg, you see a physio. But actually, our mental and emotional health, it whispers, it's subtle, but it deserves just exactly the same amount of attention.